Thank you for joining us for this presentation on Spina Bifida and Hydrocephalus. We will be covering an overview of the conditions themselves and providing information on the educational implications. Today we will be talking about what SBH Queensland can provide as a service, an overview of Spina Bifida and Hydrocephalus, a discussion about the associated learning difficulties that accompany Spina Bifida and Hydrocephalus, and the impact of these issues on the students' performance at school. SBH Queensland provides a multidisciplinary service supporting clients with Spina Bifida and Hydrocephalus and associated conditions across Queensland. These services include support and services to families, support to children from birth to 18 and then on into adulthood, support and services provided in schools and other educational settings such as daycare centres and kindergartens, outreach trips to various regional areas throughout Queensland, information and provision which is provided to the general community about Spina Bifida and Hydrocephalus, and we also have a loan pool of equipment that can be loaned out to our clients to support them in accessing their community. At SBH Queensland, we have an education and therapy team. This team works with approximately 300 children and their families throughout Queensland. In this team, we have occupational therapists, physiotherapists, speech-language pathologists, and education advisors. SBH Queensland provides services for children of school age. This is funded through education funding that we receive from the SDSS program. We work with children who have been verified through the school systems. We liaise with parents, advisory visiting teachers, school staff, education therapy teams, and specialist nurses in providing a collaborative approach to care for our clients. We also receive other external funding for some of our other programs that we provide. This can be philanthropic funding or government funding. Spina Bifida, what is it? Spina Bifida is a group of birth defects which interfere with the development of the central nervous system, which includes the brain, spinal cord, and nerve tissues. Essentially, the back part of the vertebrae has failed to join at some point along the spine, leaving a split or gap in the bony spine. Spina Bifida occurs during the 4th week of pregnancy, so often it has occurred before the woman would even know that she is pregnant. What are the causes of Spina Bifida? Spina Bifida can have an unknown etiology. It can be a combination of prenatal, genetic, and environmental conditions. The current research indicates that an increased consumption before and during pregnancy of folic acid through diet or supplements can help to decrease the risk. Families that have a history of Spina Bifida are at a higher risk of having children with Spina Bifida themselves. We highly recommend that if families do have a family history of Spina Bifida, that they link in with a genetic counsellor to help them look at these risk factors. Spina Bifida is often detected at the ultrasound at 18 weeks. The extent of damage to the spinal cord and the nerves is often not able to be identified until the birth. Often Spina Bifida can be detected at the first ultrasound at 18 weeks. There are 3 main types of Spina Bifida. Myelomeningocele is the most common and severe form of Spina Bifida. This type of Spina Bifida often results in muscle paralysis or weakness in the trunk, legs, and can affect the bladder and bowel muscles. Usually surgery is needed and is done to close the skin over the lesion within the first few days of birth. However, this surgery does not reverse the damage that has been done neurologically. The second type of Spina Bifida is meningocele. This is one of the least common forms of Spina Bifida, and in this type of Spina Bifida, often the spinal cord itself is undamaged and uninvolved in the lesion. And the most common type of Spina Bifida is the occulta. This is where the outer part of the vertebrae is not completely joined. The spinal cord and covering are undamaged and you may often have a tuft of hair at the site of the defect. In this slide, you can see a visual representation of the 3 different types of spina bifida. On the left is spina bifida occulta. In this condition, you can see that the spinal cord and nerves remain within the spinal column and that there is only a small bony part of the spine that is missing. Spina bifida occulta has the least impact neurologically. The visual representation in the middle is that of meningocele. You can see in this picture that there is a lesion or a bubble type lesion on the back, and this is actually caused by a break in the spine, which has allowed the covering of the spinal canal to come out, so that is the meninges, and most of the time that is only fluid based. You can see that the spinal cord itself has remained within the spinal column and that some of the nerves are sneaking out, but most of them are still maintained within the system itself. The third picture on the right is that of the myelomeningocele. So in this instance, there's been a bony break in the spine, so there's a bony part missing. The meninges have often come out and sometimes they are even broken in this type of lesion, and you can see that the spinal cord and the nerves that are attached to it have also been involved in the lesion itself. This type of spina bifida has a much larger impact neurologically than the meningocele or the occulta. With any of the myelomeningocele and the meningocele, sometimes you will have a covering of skin over the lesion, but sometimes not. Sometimes it will be an open lesion that can sometimes be burst during birth. So each child will present very differently depending on what their lesion type is. Hydrocephalus is a condition that is often commonly associated with spina bifida. However, it can also occur on its own and can also occur with other conditions such as Dandy-Walker syndrome. Hydrocephalus is essentially a buildup of fluid causing pressure and damage to the brain. It occurs in most people with spina bifida, but can also occur in isolation from spina bifida. Most people with hydrocephalus may require the insertion of a shunt for management of their hydrocephalus. It can affect the child's learning, concentration, language, and social skills. You can see the picture to the right of this slide shows an example of where the shunt would be placed. So the shunt is placed with a catheter that goes inside into the ventricle in the brain to help drain the fluid that is building up in that space. The catheter then goes out to a one-way valve that sits on the outside of the skull but under the skin, often located behind one of the ears. And that one-way valve will help to siphon the fluid from the ventricle down through the valve and then down into the abdominal space for reabsorption into the body. There are a couple of different types of shunts that people with hydrocephalus may have. The most common type that we see is the ventriculoperitoneal shunt, or VP shunt, and that means that it goes from the ventricle down into the peritoneal space or the abdominal space. You can also get ventriculoatrial shunts, which are VA shunts. These are less common. In these shunts, the fluid would go from the ventricle and down into the atrium space in the heart. However, this is a higher rate of infection in those shunts, so they're not very commonly used anymore. There are many different types of shunts, so some are quite simple, some are magnetic, some are programmable. So the neurosurgeon that is treating the child will look at their circumstances and discuss with the family the best options for them. As with any foreign body that is placed in our body, there are risks that shunts may fail. It may be that the shunt itself doesn't work properly. It may be that the shunt gets a blockage. There are many different ways that shunts can go wrong. It is really important for anyone that is working with children with hydrocephalus to understand the implications of a shunt malfunction and to know the signs and symptoms to look out for. We recommend all schools that have a student with hydrocephalus in their school should have a shunt management plan so that teachers know what they need to look out for and what to do in case of an emergency. The team at SPH Queensland can assist your school in identifying the particular needs of that student and helping you to put that management plan together if needed. The common signs and symptoms of a shunt malfunction can be headache, irritability, vision disturbances, nausea and vomiting, change in behaviour or personality, increased lethargy, and in extreme cases may cause seizures. Each child will tend to present differently if they have a shunt malfunction, so it is important to know and talk to their families about if they've had a shunt malfunction in the past and how they presented. Shunt malfunctions can happen slowly over time or can be quite sudden, so it's a really important thing for schools in particular to have our heads around. Children with spina bifida and hydrocephalus have many physical and health implications due to their condition. These may include, but are not limited to, the following: vision impairment and visual perception difficulties, epilepsy and headaches, delayed fine motor and gross motor skills, orthopedic problems, posture, seating and mobility issues, reduced skin sensation, issues with incontinence of the bladder and bowel, issues with their day-to-day function, an intolerance or an allergy to latex, and increased fatigue. These issues are particularly important to be aware of for school staff when they are looking after children at schools. With regards to headaches in particular, some of our children that have hydrocephalus can have daily headaches which can be quite impacting on their function in the classroom. Other things to be particularly aware of are reduced skin sensation. So particularly if you have students that are sitting on hot concrete or maybe doing home economics and carrying hot trays out of ovens or anything like that, is really, really important for school staff to be aware of whether that child has good skin sensation and whether they are safe in different environments. We highly recommend teaching children to check the environment before they sit down or touch. So for example, with hot concrete, putting their hand down and checking how hot the concrete is and whether it is safe for them to sit on it. It's important for school staff to be aware of these issues, particularly with skin, because a lot of our children with spina bifida also have reduced circulation, which can have a big impact on healing if they do get any wounds. One of the other big areas that can impact on schools is that of incontinence of the bladder and bowel. Our occupational therapist can help the school and the student come up with a good toileting management plan to help them gain social continence if possible. Other big issues for schools to be aware of as well are latex intolerance and allergies. So children with spina bifida and hydrocephalus are at a higher predisposition to develop latex allergies. For most of our students, we recommend that they take latex precautions. Even if they haven't had an allergy in the past, they are at a higher risk of developing an allergy with a repeated exposure to latex. So particularly for schools, the main equipment that you would be using that may have latex in it would be things like Band-Aids in the first aid kit, balloons, if you're using balloons in the playground or in the classroom. Balloons are one of the worst exposure types for latex because it's the powdery particles that are in the balloon that provide, that actually have the latex in them. And often gloves, so during your toileting routines with your students, if you're using gloves to do that, you need to ensure that we are using latex-free or silicone gloves. SPH Queensland's team can help you in navigating latex precautions, and if you do have a student with an identified latex allergy, we highly recommend having a latex allergy management plan at school. Fatigue is one of the biggest issues that we face with a lot of our students, particularly for those students that may have mobility issues on top of the cognitive and learning issues that they may have due to hydrocephalus and the increased risk of headaches daily. fatigue can have a huge impact on their day-to-day function. We recommend highly that schools really work with students and their families to look at how best the students can be supported to try and achieve their best, while also trying to reduce increased fatigue. Our team can help your school in identifying different strategies that may be useful for this. There are many common problems that we see amongst our students that we support with spina bifida and hydrocephalus. The following slides will delve into some of those common problems a little bit more deeply. Some students will present with issues with their fine motor skills, and this may present as very messy handwriting. If you do have a student whose handwriting is difficult to read or they are struggling with their fine motor skills and handwriting, please get in contact with one of our occupational therapists. They will be able to come out and do some handwriting assessments and also provide strategies and tips for the student as well as teachers at the school in assisting the students with this issue. Children with spina bifida and hydrocephalus may have difficulty in retaining basic maths facts, understanding multi-step problems, and abstract concepts. Many children will have difficulties with some of their language skills, as well as working memory and other executive functioning skills, which are all required to be able to do many of these tasks. Many children with spina bifida and hydrocephalus can be seen to have a lack of motivation. Often in the classroom, this can be interpreted as laziness. Students with spina bifida and hydrocephalus can have difficulty in knowing how to initiate a task, where to start with different activities, knowing where all their resources are and having their things organised so that they can actually start their task. There are many factors in their cognitive makeup that can contribute to this lack of motivation to get started. It is really important for us as educators and as a therapy team to support students as they're working through some of these issues with lack of motivation and to try and not label these children as lazy. Many children with spina bifida and hydrocephalus will present as untidy and disorganised with their belongings and schoolwork. This is related to the executive functioning difficulties that they experience, particularly with organisation and memory. There are many strategies that our occupational therapists, our speech pathologists, and our education advisor can assist students with and schools with in helping our students to maintain a better system of organisation for their belongings, as well as helping them with organisation of their thoughts for their schoolwork. Up to 80% of students with spina bifida will experience some learning difficulties of some kind. We as a team are here to help the schools and the families of these students to assist them in reaching their best potential possible. If you would like more support in how to approach this, please reach out to our team and we can arrange to come out and do a school visit and work collaboratively with your school. The particular learning difficulties that are very commonly found for children with spina bifida and hydrocephalus are in mathematics, comprehension, and their handwriting. Our occupational therapists, speech pathologists, and education advisors can assist you with strategies to assist with all of these areas of learning. There are many digital tools around now that can really assist our students in reaching their best potential with their learning. Our education advisor has a wealth of knowledge in this area and can support your school and your students in figuring out the best strategies and tools to use for this. Some examples may be using a keyboard instead of doing handwriting to help with fatigue levels. It may be using word prediction to assist with any expressive language difficulties, using speech to text options to try and get their ideas down on paper, which they can then go through and edit and work on afterwards, as well as using specific programs that can be of assistance, such as Clicker Sentences and the Clicker software programs. As previously mentioned, executive functioning skills can be heavily affected in children with spina bifida and hydrocephalus. Executive functioning are brain-based skills that are required for humans to execute or perform tasks, as defined by Dawson and Guare. The frontal lobe in particular is a very important part of the brain that works on executive functioning skills, and often can be the part of the brain that is impacted most severely by hydrocephalus. Executive functioning skills or cognition can include skills such as working memory, planning and prioritisation of our work, organisation, including organisation of our belongings, our thoughts and our schoolwork, time management, being able to look at a project that we have due and planning out how much work you need to do each week to get that task completed, and metacognition. There are lots of different tools that we can use to assist children with planning for their writing tasks. One such tool is mind mapping. Mind mapping is a great visual representation of what they need to do for that task. There are lots of different websites and apps that you can use for mind mapping, and you can also go old school with a pen and paper and different coloured pens to try and make something that's easy for your student to follow and understand, but also personable to their needs. We can support you with looking at all of the different options for mind mapping and looking at what's going to work best for that student. There are some really great iPad apps around now that can be really supportive for students in how they frame their writing tasks. Our education advisor in particular can help you with looking at what is going to work best for your student and what works best given the particular curriculum tasks that you're working on. We are more than happy to come into schools and work collaboratively with your teachers and your learning support teachers as well in looking at what is going to work best and how we can adapt that particular curriculum task to be more achievable and at the level of the student that you're working with. There are many easy adjustments that can be made to the curriculum to help the student gain really good success. Our executive functioning skills can also affect our behaviour. Sometimes this may present with response inhibition, difficulties with emotional control, difficulties with sustained attention, particularly with increasing fatigue, task initiation, having goal-directed persistence, and being flexible in our thoughts and our patterns that we use. Our education advisor and occupational therapist can help you and your students in working out the best ways to tackle some of these executive functioning skills, particularly around behaviour. Children with spina bifida and hydrocephalus often present with difficulties with language and communication skills. Often they'll present as being chatty and having good expressive language skills. However, often there are issues with their comprehension underneath this. Children will often present with good oral reading skills, but will have difficulty in actually understanding the text that they have read and being able to extrapolate from that text for school tasks. Some particular language difficulties that you may notice are issues with comprehension, being able to keep to a topic. Often children may become tangential when talking in conversations with their peers or when talking about a topic in the classroom. Some students may have issues with word retrieval and being able to find the word that they're particularly looking for, and this is often related to issues within their actual language storage system and their vocabulary systems. They may present with difficulties with auditory memory and processing of information that's presented auditorily, and often present with high-level language issues. So this can include things like inferencing, understanding sarcasm and jokes, idioms and poems, and can also have an impact on their social settings as well. Often children may not pick up on nonverbal learning language cues, so they may not understand different facial expressions, they may not understand the concept of personal space, and that in combination with their difficulties with high-level language can make navigating social settings quite difficult. Other areas that can be tricky are identifying the main idea of information. And particularly we notice that in children as the curriculum gets more complicated, and particularly when they're asked to complete projects or tasks about a particular topic. The speech pathologists and education advisors at SPH Queensland are a wealth of knowledge around the communication and language issues that a lot of our children face. If you would like support in delving into these issues further, please contact one of them. Technology has given us some great tools that we can use to assist our children with some of the learning difficulties that they present with. One such example is text-to-speech. So in this instance, the text is read aloud and may be accompanied by word highlighting. This helps to aid comprehension, fluency, word recognition, visual tracking, attention, and access to the information that's being presented. We often look at using text-to-speech as well as speech-to-text options in technology to assist our students with their learning. These can be really easily accessible on school iPads or laptops and even on mobile phones nowadays. If you'd like some support in navigating the technology space and how this may benefit your students, please let our team know and we can sit down and work through this with you. We often work with school teams around looking at how information is presented to our students and whether there is a different way that we can present it to help them with understanding the task and being able to complete it more effectively. So this may just mean actually changing the way the printed page looks. So it might be taking in consideration the font type, the size of the font, or the colour of the font that is used, the background colour of the page, the density of text, whether there is too much information on the page and whether we might need to separate it out and use some picture cues. The orientation of the print is also a consideration, and the structure and layout of how the text is presented. Sometimes when we look at curriculum sheets, they are very complex and very overwhelming for our students to understand and even start to look at. By just changing the way this is presented, we can see really good outcomes for a lot of our students in supporting them to access the curriculum and complete the tasks at hand. As previously mentioned, many children with Spina Bifida and Hydrocephalus can have difficulties with their vocabulary centres. There are some great tools around that can help students when trying to understand different vocabulary, and one of these is the Rewordify website. This website is a free online tool where you can copy and paste printed text into, and at the click of a button, it will simplify the difficult vocabulary or words that are used. This can really assist students in their understanding of research information that they might be looking up or understanding a curriculum task. It is a really great tool to have in your toolbox for your students to assist them with this area of difficulty. As previously mentioned, many of our students can struggle in the social setting. There are some fabulous social skills programs around that we have copies of at SBH Queensland and can lend to schools if you'd like to work with your particular student on their social skills. One of the series that we love is the Talk About series. There are many different books in this series that are aimed at different levels. So one for primary school, there is a Talk About for teenagers, which is great for that high primary, middle school and into high school age children. And there are also some versions of this series that are done for children with intellectual impairment. If you would like to look at what social skills programs are available for us to loan to your school as a resource, please get in contact. By teaching social skills explicitly, it can really help a lot of our children to understand social settings better and to be able to be involved in the social situation, which helps with increasing their confidence in themselves, their self-esteem, and general well-being. This brings us to social emotional well-being. The physical, psychological, and social experiences for students with spina bifida can be very different from those of an able-bodied peer. There are many barriers to socialisation for these children. This can result in low self-esteem, anxiety and depression, frustration at their physical limitations and medical conditions, and a lot of time lost from social situations through hospital interventions. Children with spina bifida and hydrocephalus do have a lot of medical appointments that they need to attend to and may miss large chunks of school for surgery or if they are unwell. This can have a huge impact on them socially. We work very closely with families and schools to try and monitor how children are going and also to put in place supports and strategies to help students in navigating this space. If you would like to discuss other options and strategies for helping to maintain your students' social emotional wellbeing, please get in contact with our team. And that brings us to the end of this presentation. Thank you very much for your time. If you have any questions or would like support from the SBH Queensland team, please get in contact with us on the details at the bottom of this slide. Thank you once again. We look forward to working with you in the future. Your student. Thank you once again.